So what I hope you can begin to appreciate is that the molecular landscape of thyroid neoplasms is complex, and we're going to introduce a little bit more complexity as we go along. But right away, it's an important concept for us to recognize that the mere presence of a mutation does not necessarily equate with the presence of malignancy, and that's particularly true with RAS mutations and that RAS family of mutations. There are certain high-risk mutations, however, that the mere identification of those mutations is likely to portend the presence of a malignancy. So that would include the BRAF V600E mutation and BRAF family of mutations such as gene rearrangements, ALK and NTRK fusions as well. So when those mutations are identified, there's a nearly 100% likelihood of the diagnosis of papillary thyroid carcinoma. Another class of mutations that we would consider to be high risk are TERT promoter mutations, and I'll discuss those more momentarily. Again, those are the high-risk mutations, the ones that we can say are very highly associated with malignancy. And then there are those RAS-like mutations that we would put into a lower risk or intermediate risk category because they can sometimes be associated with follicular adenomas or NIFPs, as well as with follicular carcinomas